When you're sad and blue and everything is putting you down, you know the world keeps spinning around. You know you're not alone.
Yes, with MS, the world keeps spinning around, but you're not alone. Welcome to the 10 Minutes for MS podcast, in which we share information about MS in just 10 minutes. In this episode, I'm glad to welcome Dr. Heather Moday, a leader in functional medicine and an expert in stress, hormone, and immunity. Nowadays, people are talking about coronavirus. Everybody's scared about the virus, and the fear increases when you have MS. So let's meet Dr. Heather Moday and know about what can virus do and how can it affect us as MS patients. So welcome, Doctor, to our show, 10 Minutes for MS podcast.
Great. So coronavirus obviously it's something that's on everybody's mind. Obviously, it's a worldwide pandemic. No country has really been untouched at this point. We're learning more and more about the coronavirus every day and how we can prevent it and treat it. And there's still so many questions out there. So we don't understand it completely. But what we do know is that there is a small percentage of the population that don't do as well, obviously, if they do contract it. So, and a lot of that is, obviously people who have what we call immune senescence or lowered immunity. That would be mostly people who are elderly or people who have chronic inflammatory diseases. Now, where we've seen the biggest impact is actually people who have heart disease, cardiovascular disease, chronic lung disease, and diabetes. So there's been no studies done specifically on people with autoimmune issues, okay? But we would suspect that if you have autoimmune disease and you are on an immune suppressive drug, that would push you into that category of being a little bit higher risk. Again, we haven't seen studies of people who either have MS or rheumatoid arthritis or anything like that who are not taking immune suppressive drugs. But we do know is that we certainly don't want to add any we don't want to add a burden to the immune system when the immune system is already sort of in a chronically inflamed state or reacting to our own tissue. So the things that, and there are some protocols that have been written up for prevention and sort of early treatment for people who have any chronic illness. And we focus, first of all, on primary things, which is decreasing any non-productive, non-purposeful inflammation. So that's making sure you're getting enough sleep, making sure that you're not drinking alcohol or taking in any other toxins, making sure that you are, not burning the candle at both ends, that this is a time that you want to be very protective of your energy. And then, of course, the routine things. Of course, like you want to be careful who you're hanging out with, right? So there's a slightly increased layer of concern for people who have autoimmune disease in case they do catch the virus. They may have a harder time clearing it, and it may escalate to some of those more severe presentations and hospitalization. The other things, so I said, were things like antioxidants. A big one that we are talking about a lot here in the United States, I'm sure also in other parts of the world, is the use of something called glutathione. So glutathione is a very strong antioxidant. It is available in supplement form. It seems to be extremely protective in the lungs in terms of like decreasing free radical damage, specifically in the lungs. And it also helps our body detox from things. So a lot of people are using glutathione, or it's the precursor to it, which is called NAC, or N-acetylcysteine. That's the whole, the name, but we call it NAC. Both of them are available over the counter. And that they're safe to use. They're safe for people with MS. I use it all the time. So that's another thing to think about. There's a couple other things that might help for, also specifically, we found for people who have autoimmune disease or allergies, and that would be to use things that actually increase our body's ability to fight viruses. The big one that we talk about, there's two actually that are both sort of herbal. One is a very common Asian botanical medicine. It's called astragalus. You'll often see it in root form. Some people make tea out of it. That actually helps our natural killer cells be a little bit stronger, and our T cells, the ones that the type of T cells that fight viruses. And then the other one is a substance called reishi mushroom, which you won't find. You don't find it growing in the ground. You don't use it in making dinner or culinary dishes, but you'll usually find it in like a tincture form. So either in like drops you can put in something, or in a pill form. Sometimes you'll see it in tea forms. So like reishi mushroom astragalus, they're both very antiviral. And so those can be helpful really for anyone to take. But for people in particular who might have autoimmune issues or have like a lot of chronic allergies and tend to go towards that direction, those are good things to consider too.
That was a very good information. Is there any kind of exercises or meditation that can help us strengthen our immune system during this current pandemic?
Yes. So we know that for everybody, a big trigger for the development of autoimmune disease and also something that continues to cause flare-ups is chronic stress. Mm-hmm. And right now we're all in a state of chronic stress. Probably all of us have more stress than we normally would. If you went back to 2019, we would have much less stress. And that's different reasons. But I think that we have to really counteract that. And because we can't really change the situation outside our doors, but we can change what's going on in our bodies. And so one way is meditation. I think it's the best way, really. Any type of meditation that suits you. It doesn't have to be any one particular kind. So some people like to do breathwork meditations and mantras. Some people like to do walking meditation. Some people like to do body scans, which I think is really good for people with MS because you're really concentrating on different muscle groups in the body and relaxing them. And you don't have to do long sessions, 5 to 10 minutes. I think the most important thing is doing them every day. So being consistent. And that can significantly change how our cortisol levels are. And the more even our cortisol levels are, the less it's going to hurt our immune system over time.
During this COVID time, we are hearing people talking about antibodies. So what exactly it is and how is it related to this pandemic?
We have a lot of different types of antibodies in the body. Some primarily are dealing with allergies and parasites and things. And, our antibodies all have sort of different jobs. There's actually 5 different classes. But the one that, when you're hearing in the news and people are talking about antibodies, they're talking about a class of antibodies that are called IgG. The Ig part just stands for immunoglobulin. So immunoglobulin G. And it's the antibody that floats around in our bloodstream the most. It's also the ones that it's the class that makes protective antibodies against things like bacteria and viruses. So for example, when you are young, let's just say you get chicken pox, or even if you get a vaccine for something, right? Within the first couple of weeks, you make an antibody called IgM. It's a very strong antibody, but it doesn't last for a very long time. And then it switches to this sort of long-lasting protective antibody called IgG antibody. So you can have IgG antibodies to chickenpox, you can have it to flu, you can have it to strep bacteria, you can have it to coronavirus. They can be lifelong or years. And what happens is when we see that infection again, say we breathe in some particles of coronavirus after we've had it, theoretically, our immune system remembers it, right? It can send out all these antibodies. And antibodies, what they do is they coat whatever the microbe is, they tag it so that other cells can come and kill it. It really tags it for destruction. So those antibodies float around and we have a memory of them. We're also able to make them on command much faster when we've seen the infection before or we've been vaccinated before. So it's a great protection for preventing from getting sick again.
Would you like to give some advice to all the MS patients listening to this and tell them that you don't have to fear coronavirus, you just have to stay protected?
Yeah. So, and we see that here too. So don't feel that, there's a lot of people that are very scared. And I would say that, although we should practice caution and do appropriate things like wear masks, if we feel that we're more fragile, either we're on immune suppressive drugs or we know that we get sick pretty frequently, we might want to be a little bit more reserved and careful. But I think fear is not a good thing because what fear does is it actually makes our stress worse. And when we have chronically elevated stress hormones, it actually decreases our immune system's ability to work very well. What I tell people is don't focus on that. Like focus on what you can do. Focus on really taking care of your body, like restorative exercise, like yoga, investing in maybe what you're eating, and put your focus on that. Focus on really getting the best sleep you possibly can. Turn towards like, okay, what do I have control of? What can I do to make myself strong? You'll just feel better. Obviously doing a much better service for your immune system,
Thank you, Doctor, for this wonderful advice and for this wonderful informative session. Thank you so much for coming to our show.
Thank you. I appreciate it.
thank you, warriors, for being with us. I hope you found this session useful. We will be back again next week with another informative session. So, don't forget to subscribe and reserve just 10 minutes for MS.
You know you're not alone.